prostate tonight. And the reason I do these talks, and some of you have never been to one of my talks, I'm just going to go through this. The reason I do these talks, several reasons. Number one is I want you guys to be healthy enough to where you don't have to see me or any other doctor as often, okay? And if you can learn to take care of yourselves, you can accomplish that. The second reason is I want you to make better healthcare choices for yourselves, be more intelligent about your health, to understand how the body works and how systems work and how nutrition works, so you can make better decisions about your healthcare in general, okay? Would you agree that there's a lot of people out there that make poor healthcare decisions, okay? I mean, I'll give you an example of that, and I don't think this individual's watching tonight, especially since it's a woman. But I have a patient. I like her a lot. She's doing pretty well. But she'd seen me a long time ago and done real well. And then I hadn't seen her for like maybe 7 or 8 years. And in that time, her low back pain came back again. And so she went to her general practitioner, who shunted her to an orthopedic surgeon who did back surgery on her that basically failed, okay? So she came in to me, a couple of months ago. I mean, incredible amount of pain, could barely walk, a lot younger than I am. She's probably 15, at least 15, maybe 20 years younger than I am. Could barely walk, and is a back surgery that probably wasn't necessary. And she realizes now it was a poor healthcare decision. And I want you guys to avoid stuff like that, okay? Now, I'm not saying anything against the medical profession, because they do some good things, but I want you to make better healthcare decisions for your lives. When it comes to thinking about health, I want you to think that there's other things out there rather than pharmaceuticals and surgery, okay? So the last thing, the last reason I do these talks is because I want you to understand that health is a lot more than just being in or out of pain, okay? Let me ask you this. Do you think that pain is a good indicator of health? I'm glad nobody's raising their hand, okay? Like, we're going to talk about the prostate tonight. Do you think there's a lot of people out there who have prostate surgery, who found out they had prostate surgery, or not surgery, but prostate cancer, that had no symptoms? Happens all the time. You can walk around with cancer for a long time and have no symptoms. Now, what does that say about health? It doesn't mean you're healthy if you don't have symptoms. I mean, you fell and broke your arm, right, Max? Obviously, right? So did that hurt?
Oh, yeah.
Yeah, it hurt. Yeah. Well, it should hurt. When you fall and break your arm, that's normal to have pain, okay? So there's some, if you get food poisoning, which I did when I was in Haiti, way back in the 80s, and it comes out of both ends, that's a normal reaction for the body. Your body is reacting. You have major symptoms, but your body's reacting perfectly to the situation. So symptoms are not necessarily an indicator of health. And that's the other thing I want you to understand. So let's get into this. The prostate is a walnut-shaped gland right here, just inferior to the bladder. So this is the bladder. Bladder runs through the prostate, down to the penis. BPH stands for benign prostatic hypertrophy, which is an enlargement of the prostate, causing a narrowing of the urethra. So this is a normal prostate here, enlarged prostate there. This enlargement can cause a backup of urine into the bladder, and it results in bladder obstructions, which means, you can't get it out. Now, for you guys that are really young, that's probably way off in the distance, okay? But for some of us that are older, this can be a reality, and it's not much fun to have this issue. 50% of males over 50 have that problem. So if you walk around, you go to the mall, every other man that you see over 50 is going to have issues with his prostate. Now, obstruction of the bladder is not good. It can lead to nighttime urination, urinary frequency, difficulty starting and stopping urination. I mean, so you get it both ways. Weak stream and dribbling. There's lower urinary tract symptoms have a strong correlation with blood sugar dysregulation. Now, we just got through a season. You think people might have eaten too much sugar over Christmas? Maybe, okay? Yeah, I to be honest, I ate a little bit more than normal, okay? But blood sugar dysregulation, and this is going to be a recurring theme in this talk tonight, is a huge, big deal. In other words, if you can keep your blood sugar regulated throughout your life, you are going to be so much healthier, you would not believe it. And we'll talk more about that later. So, common factors causing blood sugar imbalances: poor nutrition, okay? So, when we talk about poor nutrition, what are we talking about causing blood sugar dysregulation?
Heavy carbs.
Yeah, like eating lots of sweets. Eating things like, sugary sweets, bagels.
Sugar-coated carbs are the best. Donuts.
Yeah, well, sounds like the voice of experience right there. Poor quality sleep, low vitamin D, which a lot of people have. Thyroid issues, a lot of people have, and chronic stress. I know none of you guys have any stress, but there are some people out there that do. Okay, factors known to have a positive effect on BPH: increased physical activity. So I think this is like crucial, okay? Proper exercise. Now, what do I mean by proper exercise? Now, we hear this thing about, if you just go out and walk a mile, that's good. And that is good. Walking is good. But I found that for prostate issues, high intensity physical exercise is really good for the prostate. Really, really helpful for the prostate. Walking is good. I mean, that's better than nothing, but you need to do more than that. And I would even go so much as high intensity physical exercise, maybe some weightlifting, something that's really taxing your system. Okay. So, I do a lot of high intensity exercise, and that's really, I come from a family of prostate issues, and that's really helped me a lot. Increased consumption of fruits and vegetables, okay? So, if the last vegetable you ate was when you were 10 and your mother made you do it, that's not enough, okay? You need to increase it a little bit, all right? In fact, a lot. Lowering insulin levels, okay? This is connected to what?
Pancreas.
And
your blood sugars and sugar.
Blood sugar, yeah. In fact, insulin, one of my favorite blood tests. You show me somebody's insulin levels, I can tell you a lot about their lifestyle. Just that test. Reduce oxidative damage to the prostate. How do we do this? What does that mean? We say reduce oxidative damage. Anybody? Nobody knows? Okay, so oxidative damage comes from not having enough what we call antioxidants in our system. So, can anybody name me some classic antioxidants?
Pomegranate.
Yeah, pomegranate is a fruit that contains a lot of antioxidants. Yes, very good. How about things like vitamin C, vitamin A, zinc, magnesium, basically just a lot of vitamin E, very good antioxidant. I'll tell you, what another good antioxidant is? You're going to be shocked by this when I tell you this. You'll never believe this. Cholesterol. Cholesterol is a powerful antioxidant. And when people take cholesterol-lowering medications, they get their cholesterol really low. So one of the things they're doing, they're depriving their body of one of the most potent antioxidants that there is. And, you know, we've been practically talked to death about the need to lower our cholesterol. That's making the pharmaceutical industry rich. It's making our population sick, okay? So here's another thing. This causes this. So increasing fruits and vegetables reduces your oxidative stress, okay? So those two go hand in hand. Actually, increasing physical activity ultimately will also reduce oxidative stress, although physical activity does increase some free radicals, but then there's a rebound effect on that, which is good. Okay, common pharmaceuticals for the prostate: Flomax, finasteride, and sildenafil, or sildenafil, okay? You know, sometimes you got to take this stuff if it's really bad, but they do have side effects. These drugs, ejaculation dysfunction and dizziness when standing, you know, so side effects aren't great, okay? And all drugs have side effects, all of them. Even if you don't feel the side effect, it has a side effect. What's the most common side effect of any pharmaceutical? Who can tell me?
Insomnia.
Drowsiness.
Okay, not all pharmaceuticals cause drowsiness. I mean, that can be one. What's the other one? Kidney damage? Yeah, that's a pretty good answer.
Inflammation in general? Or not?
Okay, what about even with anti-inflammatories? It is. I'll give you a hint. Okay, it's not a symptom. Not a symptom.
Depression, anxiety.
That's a symptom.
Liver damage?
That's pretty good. I'll just tell you.
Gastrointestinal.
They eat up vitamins and minerals. They deplete your body of vitamins and minerals. All pharmaceuticals deplete your body of vitamins and minerals. And I have a book back there that can show you which classes of pharmaceuticals deplete which vitamins and which minerals. So, for example, let's take statin drugs, one of those common pharmaceuticals taken. What do statin drugs deplete in the body? I mean, they just decimate it. Anybody?
Is it coenzyme Q10?
Yeah, coenzyme Q10 is one. What is coenzyme Q10 for? What do you need that for in your body? You need to produce energy. It is one of the key nutrients to produce energy in your body. So, if you're lowering coenzyme Q10, what might happen to your energy? Might go down. Okay. What's the other one? Statin drugs absolutely devastate this particular vitamin. It's really not a vitamin; it's a hormone. But
is that vitamin D?
Vitamin D. Good answer there. Absolutely, vitamin D. Okay, vitamin D is crucial for your immune system. So we got all these older people succumbing and dying of COVID. How many of those older people do you think are on statin drugs? Lots of them, okay? Lots of them. All right. So here's the invasive option, the TURP procedure. I mean, just looking at that practically gives me the willies. I mean, how many of you want that done? I certainly don't. My next door neighbors had it done twice. Okay? I don't want it. Okay? Never had it. Don't want it. I want to die someday without ever having had that. Okay?
Are they injecting?
Oh, they're basically reaming this out, making the prostate bigger because it's inflamed around the urethra. Okay. So they're actually, cutting some of that out. By the way, not only does that not look very appealing, do you know how much this cost? This is about a $40,000 procedure. Okay? Now, let me ask you this. How many fruits and vegetables could you buy for $40,000? How many gym memberships, how many months of gym memberships could you buy for $40,000? I mean, come on. How many of my supplements could you buy for $40,000? And I know my next door neighbor, who I like a lot, I like the guy. I know he's not watching this talk. He doesn't believe in much of what I do. But you know what? He doesn't want to, he gets some exercise. I'm not saying he doesn't exercise, because he does. but there's the other things that he does that aren't great, okay, that are not good. He said 2 of these. That's, so, you're talking about $70,000, $80,000. Now, now his insurance probably covered part of that, but you still got a copay and all that. It just, to me, I don't want it. I'd rather just prevent it. Okay. Key areas to evaluate when working with prostate issues. Okay. So diet for sure. Let me talk a little bit more about diet and prostate. Here's what I found with prostate issues. I found this very, very consistently. Food intolerances can cause prostate problems, and it's different for different people. Like there's certain foods, if I eat them, my prostate will act up, okay? I can almost count on it, all right? So those are things that you should kind of categorize in your head. So food intolerances, when you're intolerant to a food that causes inflammation in the body, and it can cause inflammation in any area. So certain foods, like, what are typical foods that cause food intolerances and inflammation in the body?
Number 1, wheat.
Yeah, wheat.
That will do it.
Now, wheat doesn't do it for me at all, but it does it for a lot of people. What else?
Dairy.
Dairy, yes, dairy. What else? Corn or sugar, okay? Or a combination of sugar and dairy, i.e. ice cream, is another one. So those are things that's a big deal. Digestion, blood sugar, we already talked about that. Elevated blood sugar equals elevated inflammation. Liver detoxification issues, inflammation, lifestyle and stress, occupation, and spinal subluxation. Now, what does spinal subluxation have to do with the prostate? Prostate issues. Anybody?
Impedes the nerve impulses and the communication.
Man, I'm glad you said that. Somebody's learned something from what I've said in chiropractic. Yes. So
she's feeding me the answers.
Okay. Okay. All right. Yeah. Well, she's being good then. Okay. So prostate. So spinal subluxations. Does a prostate need a nerve supply?
Mm-hmm. Yeah.
Yes. Where does that nerve supply from the prostate come from? It comes from the lower back, the sacrum, L5, L4, L5, and the sacrum. That's where the. So if you injure your lower back or you have low back issues, that can substantially contribute to prostate dysfunction. Now, I'm not saying it's causing all of it, but it'll definitely contribute to it. So this is a real issue. This is a chiropractic problem. The rest of these aren't so much chiropractic. That one is, okay? So if you have chronic lower back pain and you have chronic prostate issues, there may be a connection there. So key targets, again, blood sugar, insulin, liver toxicity, nerve supply to the prostate. Nutritional considerations. Prostate PMG, great product, helps with inflammation, urinating at night, dribbling, and low libido. Cataplex F, this is my favorite product for the prostate. It's an unsaturated fatty acid, helps transport calcium to the tissues, improves serum phosphorus, normalizes serum iodine, because there is iodine in here a little bit, and it reduces prostate muscle spasms. I take this regularly. This is what I give. This is Cataplex F is really good for muscle spasms, really, really good for skin issues. Like if you know somebody whose skin just breaks and bleeds, they need Cataplex F. It's really good for that. Good for a lot of things, okay? I take 6 a day, every day. Gymnema, great herbal product for lowering insulin. I've seen this product work over and over and over again for lowering blood sugar. Now, there's a distinct relationship between the thyroid and the prostate called the prostate-thyroid axis. Prostate health can influence thyroid health. So if your prostate is unhealthy, that can actually pull down your thyroid, and your thyroid won't work as well. How many of you have ever heard that before? Probably nobody, okay? You don't see it on TV, okay? That's why you gotta come to my talks, so you hear this stuff, all right? So, improvements from utilizing Cataplex F. Reduces prostate size, elimination of pain and discomfort, bladder emptying, peeing at night, and increased libido. Palmetoplex is another great product I have for the prostate. Really good for inflamed prostate and gonads. It's really good also for female pattern baldness, because one of the things that palmetto does is it decreases the conversion of testosterone to dihydrotestosterone, which is what causes male pattern baldness, prostate issues, all kinds of things that men don't like when they get older. So palmetto is very good for that. It also contains prostate PMG, which I've talked about, alanine, which is another product good for the prostate, and zinc liver chelate. Zinc is like the male mineral, okay? Very important for men to have zinc. Also, zinc kills COVID, okay? Just has to get into the cell to do it. And that, by the way, no extra charge for this piece of information. That's what ivermectin and hydroxychloroquine do. So they open up the cells so zinc can get in and kill the virus, okay? And by the way, here's something that works a lot like that, is quercetin, which you can buy over the counter, okay? So that's an aside from my talk. So Prostex is another product I have, good source of phosphatases that help with calcium metabolism, good for painful intercourse, prostate symptoms, and loss of sexual climax. Now, liquid nettle is also good for the very things that we just talked about, okay? It helps stop the conversion of testosterone into dihydrotestosterone. This is an herb, okay? I don't carry this generally. I don't have it on hand, but it is good for that. Cranberry complex, really good for prostate infections, okay? Good for urinary tract infections in women as well. You can take it prophylactically, 3 to 4 tabs a day. Echinacea, one of my favorite immune-enhancing herbs, helps reduce prostate size and slows degenerative changes of the prostate. So echinacea is, I've heard it described, this isn't my description, like the duct tape for the body, okay? So I've heard echinacea.
The question is then how often can you use it? If you use it on a regular basis, do you get immune to the beneficial effects, or do you need to use it just sporadically?
No, you can use it regularly. It's fine. Just it'll keep your immune system at a higher level. Yeah, it's good. Okay, let's talk about prostate cancer. So the majority of health issues pertaining to men revolve around the following 6 issues, okay? Obesity, high blood sugar, hypertension, increased serum lipids, smoking, and excess alcohol. If you can keep these under control, your chances of getting cancer, prostate cancer, all the male issues that we've talked about go way, way down, okay? So keep those under control. You're going to be a lot healthier. And and there's a lot of other countries where the average person has these under control. America, this is primarily a Western problem right here. Okay, you go to the bush tribes of Africa, these people that live real primitively, that are basically hunter-gatherers. They don't have any of these issues. Okay, they don't deal with them. It's pretty interesting. They don't eat the Western diet. They don't have a lot of our health issues. Now they have other issues. I mean, they have to avoid being eaten by a lion. We don't have to do that, or by a hippo. But they don't have the health issues that we have because they don't eat like we do, and they're constantly exercising. It's prostate cancer. Older men are at greatest risk, especially those with family history or higher PSA. We'll talk about PSA in a minute. Infection and inflammation are causative factors. We just talked about that with So if you can keep your prostate inflammation down, your chances of prostate cancer go down. A lot of times men are put on watchful waiting because prostate cancer can be very slow growing. And medications given to shrink the prostate have significant side effects. So let's talk about PSA. Test, a very common test for the prostate. PSA, prostate-specific antigen, is an enzyme produced by the prostate to keep the semen liquid. It's a very controversial marker, and I'll tell you why. 75% of men with elevated PSA do not have prostate cancer. 75%. 20% of men with prostate cancer have a normal PSA. Okay? So there's other ways to, PSA is not the best. There's other ways of being diagnosed for prostate cancer. PSA just, it is an okay marker to look at prostate inflammation, but it's not a definitive test. Okay? Important items to consider with prostate cancer. Address any inflammation, okay? Improve immune regulation. So let's talk about some supplements for this. We just talked about one, Echinacea. Very powerful for immune regulation. What else? Any other ones that anybody can think of? Help with the immune system?
Zinc.
Zinc, good job, yeah.
Golden seal.
Golden seal, okay. How about whole food complex vitamin C? That's a powerful immune supplement, okay. I'm going to tell you another one too, mushrooms. Mushrooms are powerful, powerful immune boosters. Lots of good research on that. And by the way, when I show these herbs up here, there's a lot of very high quality research on herbs. You may not see it on the blur of pharmaceutical commercials on TV. There's a lot of very good research on these herbs. So when I talk about herbs and what they do, it's because there's been research done on them. Herbal considerations for prostate cancer. There's an herb called skullcap. Curcumin, which we know is turmeric, really good, causes apoptosis in prostate cancer. What is apoptosis?
When the cell kills itself?
Yeah, it's basically cell suicide, okay? Boswellia is an herb, inhibits angiogenesis, which means the formation of new blood flow into a tumor. Cat's claw reduces inflammation. Red wine has been associated with decreased risk of prostate cancer. So I guess after this talk, we'll all go out and have a glass, huh? Or I'll serve some after.
Is that an antioxidant component of red wine?
Yeah, and there's a lot of other stuff in red wine that's good for that. Grapeseed extract is good, and resveratrol. Now, grapeseed, this is in mice and rats. You can't always do a one-to-one correlation, but there is some there. So flaxseed shows promising results for prostate cancer. Mushrooms, I just talked about that. There's a lot of research on mushrooms inhibiting cancer. Green tea, okay, is good. Green tea is just really good for a lot of things. And milk thistle works really synergistically with chemotherapeutic drugs.
Somewhere I read on flaxseed, though, you got to be careful. It goes bad or rancid, it gets old. So if you do it, some people say don't buy it pre-ground. You grind your own. What do you know about the validity of that?
I agree. I think that's right. Yeah, you grind your own.
And if you whole flaxseed doesn't digest well, so you really need to get it.
You got to grind it. Yeah. Otherwise, it just becomes roughage primarily. So these are all the things that inhibit cancer. What would be one thing that grows cancer that's like miracle grow for cancer?
Sugar.
Sugar is like miracle grow for cancer. Okay. And so, and I do a whole talk on cancer where I get into that. We're not going to do that tonight because I don't have time. So we carry these products in our office. Boswellia, Linum B6 is flaxseed in a capsule, very good product. Turmeric Forte. And the Glycan Renew is a really good mushroom product. There's about 6 different mushrooms in here. So these are all things that are very, very good. So that's all I have tonight for the prostate. So if you know of people who do have prostate issues, tell them that there is hope, and there's hope beyond pharmaceuticals and procedures for those people. And they may need things like lowering their blood sugar. They may need to exercise a lot more than what they do. I mean, there's a reason why men in Western men get so many of these problems. Is because we live in a society that really kind of creates these things. I mean, we have a lot of sitting jobs nowadays. We eat a lot of foods that inflame our bodies. And so there is hope, though. There is, changing your diet, getting in the right supplements, being guided through this process. And so, we do functional medicine in our office. And so if you know people, and you probably do, have prostate issues, have them call Carmen. I'd be happy to sit down and talk to them. And I'm working with a guy right now who has prostate issues, and I put him on Cataplex F and several other things, and he's doing better. Now, he's only been on that stuff for about 5 weeks now. About 5 weeks, so he's not healed, okay? And here's the thing I want you to understand about health issues. This is the last thing I'm going to say. Let's say you're 40 years old. Let's say you weigh 200 pounds at 40. And at 50, you weigh 300 pounds. So you've gained 100 pounds over 10 years. Okay, so over a decade. How long is it going to take to lose that extra 100 pounds?
10 years.
Tell me. How long? A year? You work hard on it, maybe a year? Maybe longer, okay? Most of the people that come into me, not everybody, but a lot of the people that come into me have had problems that have been building up for at least a decade. And it takes time to fix that. You can't fix it in 3 weeks or 2 weeks. Or like one 93-year-old man called my office once and said, I want my back fixed in one adjustment. I want that guy as far away from my office as he can get. Okay, can't do it. Okay, I cannot do that. If something's been building up over a period of time, it's going to take time to reverse it and fix it. Okay, so thank you so much for coming tonight. We do our next talk. Is it 2 weeks?
Thyroid.
Yeah, it's on the thyroid in 2 weeks. Is that correct?
Yep.
2 weeks. We're going to do a talk just like we did tonight, except it's going to be on the thyroid. Okay, so you probably know some people with thyroid issues. Go out and tell them about the talk. Our talks are free, and they'll learn. They'll know more about the thyroid than a lot of PAs and general practitioners after the half hour that I have with them. I promise you that. Okay, I promise you they will. So that's in 2 weeks. Thank you so much for coming tonight.